I just didn't want to be alive anymore. And that was a very clear and real and frightening, constant thought.
So were you thinking of harming yourself? Were you having suicidal thoughts?
Yes, this was very, very clear.
Wow.
Meghan Markle's bombshell interview has sparked conversations about mental health that are sorely needed right now. During the pandemic, the number of Americans reporting symptoms of anxiety or depression has quadrupled, according to the Kaiser Family Foundation, and many people of color struggle to get help even in the best of times. Mental health specialists estimate that in the U.S., only 1 in 3 Black adults who need mental health care actually receive it. Joining me now, Dr. Callie Cyrus, psychiatrist and board member of the Committee to Protect Medicare, and Dr. Joy Harden Bradford, psychologist and host of the podcast Therapy for Black Girls. Ladies, very happy to have you here. You know, when I watched this interview with Meghan Markle, I was just stunned. So Dr. Harden, I want to start with you because you talk about these issues. For people who are struggling with anxiety and depression right now, we've seen a lot of people are losing their jobs, so maybe people don't have health care to deal with this. What's one to do if they have these thoughts?
Yeah, this is a really important conversation, Tiffany. I'm really glad that you're broaching this topic. So I think it is really important to talk to someone about any feelings that you're having in terms of struggling. So there is a crisis text line that you can access here in the U.S. You can text the word hello to 741-741 and chat back and forth with a licensed texter. But it really is important to talk with someone, whether it be the crisis text line or someone who is a family member, someone as a member of your congregation, if you're a part of a faith community. It really is just important to let somebody know that you're struggling because it can help to take the load off of you.
So, Dr. Cyrus, let me ask you, Michelle Obama also, Forever Flotus, as we call her, she also spoke about challenges with her mental health during the pandemic. So let's say that you're struggling. You're not necessarily suicidal, okay? But let's just say you have anxiety, you're sad, you're depressed, and one day you feel like you're on top of the world. The next day you feel like the world is on top of you. But you don't have health insurance, and there's no recourse for you. What should those women do if it's not serious enough where you need to be on suicide watch, but you're just struggling with life?
I cannot underscore what Dr. Joy said, which is just talk to somebody. So often we keep this inside. I think that was one thing that was notable about Meghan Markle's comments was the shame that prevented her from getting help. And that shame can be very real, especially in the Black community, looking at studies of why Black people might seek help. And there was a study that said about 63% of Black people didn't want to seek help because you would look weak for a mental health condition. And so that's why it's just important for people like Michelle Obama, people like Taraji Henson, for people like me as a psychiatrist who talks about being anxious, to talk to people about it. Let them know that it's a normal-ish thing, right? Like you're not the only one who's suffering. And so I would say, don't let the shame cripple you in trying to get some help. And so talk to your pastor, even if it's not someone like a psychologist or a psychiatrist or a social worker. Literally picking up the phone and phoning a friend is one thing that you can do, and not let it, sort of cripple your idea of being a strong Black woman, because seeking help is what makes you strong in these cases.
Yeah, you talk about that. And that's the one thing that I want to make sure that we get out of this conversation, that it is very normal. You know, I do agree with you that it is stigmatized. You said people like you, Michelle Obama, people like me. You know, I don't know anyone who hasn't had some level of anxiety or sadness or depression during this time. But so specifically talking about women of color, I think particularly in the Black community, Dr. Harden, that we're taught to be, put that S on your chest and get out there and face the world. How do you unlearn that behavior? Because there is some sort of let me just swallow it and get up the next day and face the day with gusto, like the ancestors, How do you unlearn that and navigate this world today where mental health is a lot more prevalent with people?
Yeah, I think really in sharing our stories is where the strength to kind of unlearn some of that comes from. The more that we talk about the ways that we are struggling, the more we're giving other people space to recognize that they may be struggling as well. I think that when we are sharing it and it's not this dirty little secret that we're keeping, kind of locked away, we are then able to unlock the resources that we need to tell the truth about these things and to recognize that we're human. We're not robots, right? Like there are a lot of great things that we can do, but we are all still human, and so it's important to know that we can embrace our feelings and take care of ourselves when we're struggling as well.
Dr. Cyrus, I think addressing systemic racism in healthcare is going to take work, commitment, but also data, and just creating a pipeline to have people. I know I have friends who look for therapists who are African American to speak specifically to their children. I imagine it may be the same way in the Latino community and the API community and certainly the Native American community. What will it take to make our healthcare community more diverse or to make the existing members in our healthcare community more culturally competent?
Yeah. I'll be honest, it takes money. If you look at the healthcare system and the way that it is, it's so hard to find a healthcare provider. I mean, forget the fact that if you're trying to find a provider who looks like you and you are Black, that's more than likely not going to happen. I think the most recent data, at least for psychologists, in 2015, showed that maybe some 86% of psychologists were white and only 4% were Black. And so you can imagine, one, just by investing in STEM programs and recruiting people from when they're in middle school, which is how I became a doctor, is one way to increase representation. But in addition to funding for education for people of color and trying to diversify the workforce, we also need legislation that ensures that money is actually appropriated to community health clinics. So often it's put into legislation, this funding doesn't go through, or the funding runs out in 5 or 10 years, and you have clinics that are scrambling to refund programs. So I really think that it's money. Our mental health system is just incredibly fragmented, incredibly complicated to navigate, and there are not enough access points for people to get to. And it really just is going to take some actual money. And then also in education, obviously, I think that's something, which means then you have to pay the people who are going to be doing the cultural competence education, which is a whole nother conversation on its own when you're thinking about the number of Black academics or Blacks who enter in academic medicine trying to help with cultural competency education.
Yeah. So, Dr. Hardin, let me ask you. This sounds completely insane to me, but colorism has been linked to depression and anxiety. And according to some research, it suggests that people in the Black community with darker skin tones have higher levels of depressive disorders and are more likely to experience trauma with less access to mental health service. This is insane to me. But again, after hearing that interview where the royal families were discussing Archie's skin tone and systems of oppression that teach people that fairer skin is somehow better than darker skin, as insane as it sounds, it's also understandable. I think this is why it's so important to have, cultural competency in the medical community. Have you seen that firsthand?
Oh, absolutely. I mean, it's an incredibly painful history in terms of what, darker skinned brothers and sisters struggle with, and the research is clear that the lighter your skin is to white, the more privilege, of course, that you have in the country. And so it's not at all shocking to me that colorism plays a role in people feeling more anxious, more depressed, being locked out of more opportunities. We know that all of that is tied together. So I'm not surprised at all by that.
Well, we'll have to have you both back to continue this conversation as so many people continue to struggle with mental health. So thank you so much, Dr. Callie Cyrus and Dr. Joy Hardin Bradford. You'll both definitely be back. And coming up.